The concept of the medical center in Sewickley coming together started in November of 1995. Larry Kroll, the new CEO of the medical center, and I met for lunch and talked about the current healthcare environment. And it was fairly chaotic. Large hospitals were trying to attract physicians from community hospitals. Community hospitals were competing with each other. Both of us felt that our hospitals wanted to remain largely independent of the larger downtown hospitals.
Many institutions were seeking physician groups to join with them because that would strengthen their position in the marketplace. At that point in time, we had 3 different institutions in the Pittsburgh market that were trying to acquire us, and I thought it was important to this community and to this hospital to try to maintain as many physicians as they could that were local. As we see now across the country, more and more communities are losing their hospitals because they're being devastated by institutions with more financial backing that are acquiring their practices. And what that leads to is that people have to go elsewhere for the services that they would normally get at their own institutions.
It became obvious that we had a lot more in common than we thought, and that perhaps we should begin to look at something stronger than just an affiliation, and that would be a consolidation. Lots of things had to be done, but it seemed that if we wanted to retain our vision of being a community healthcare center for the population, that this was the way to go. In November of 1996, we consolidated.
I've seen a lot of changes take place over time. The information systems is a big change that's taken place with the information technology that allows everything from the electronic health record to the kiosk to check in, and just being able to allow doctors and patients alike to be able to gain access to their information.
We're keeping an eye on not just what's happening locally, but what's happening nationally, because we're part of that bigger picture and we can learn from that.
This board has been very committed to technology. Well before my time, they made a commitment, stepped up, took a real leap of faith. We spend a lot of money on technology, and I think it prepared us for things that have come in the last several years that we didn't even know would come. The requirement of the electronic medical health record, everything through the Affordable Care Act, those are things for which we were ready without even knowing 10 or 12 years ago when we took this leap that would come down the pike.
There are huge challenges in terms of all the changes that are taking place, the way payments take place. Payment in the future is based on the results that you get and not the services that you provide. That's a lot of change for the hospital to be able to track quality, improve quality, lower cost, all at the same time.
The challenges for Heritage Valley Healthcare System is that it's a community-based, small healthcare system in an era when bigger and bigger and bigger is the trend.
We are a community-based provider in a very competitive southwestern Pennsylvania environment. We've got a couple behemoths that are really, nipping at our heels all the time. We're neutral. We are payer and provider neutral. We take all insurances. We try to work with everybody, and it's always more cost-effective to collaborate than compete. That's enabled us to form partnerships and joint ventures that have been accretive to the bottom line, but it's also helped us to serve the community in ways that we probably wouldn't have been able to on our own.
Trying to stay afloat and staying in pace with healthcare reform is our biggest challenge, which we're addressing, actively forming a clinically integrated network. But trying to bring all providers along to the same level, I think, is one of our biggest challenges.
But what really impresses me about all of it, whether it's the physicians that I interact with or it's the others that I interact with, the lawyers or the business people from the board, is their commitment to this organization. And I think that's one of the greatest things about this organization is that the people that are involved here, whether it's board members or physicians or nurses or anyone who works in the organization, is their commitment to being the best.
It is unique, the relationship the physicians have with the administration here.
Being physician-led, we've always had a voice. We've always been able to have a seat at the table to help move the system forward. We've been respected, and we practice and work as a team.
The board members devote so much time and effort to the process because they feel like they're making a difference and they're having an impact.
We've dealt with the financial crisis that began in late 2007 and ended in 2009. We've dealt with the Affordable Care Act and all the changes that have come from fee-for-service to outcomes-based medicine. And I think the board has worked really hard on educating itself. We've worked really hard to learn healthcare and learn the system. That education has helped us to really position ourselves to be open to whatever the future holds. Our Moody's and Fitch and S&P ratings really differentiate the Heritage Valley system from our competition.
As an educator, I think education is important, and that includes education of the board members, the continuing education of the clinicians. That's a focus for Heritage Valley, and an important one. What happens when I come here is that I see the things actualized that I always wished would happen or envisioned would happen in a healthcare system. I feel like I've learned a great deal from being here, and it's helped to inform my own work as somebody who's educating the next generation of healthcare providers.
One of our challenges is to be sure at the end of the day, the providers are still doing what they're best at, and that's providing medical care. That we're supporting them as best we can with, the electronic health record, with case management, with sharing resources, with developing best practice protocols.
I think the board is as strong as it's ever been right now. And it's because they do work together. It's a very effective board from that standpoint. People bring a lot of different backgrounds to the board, but the discussion is very open. Everybody feels comfortable saying anything and challenging any point. And that it makes a big difference in terms of making sure that we make good decisions.
We're fortunate that we have a physician-friendly CEO, which is very unusual in that at any time of the day, you can walk into the CEO's office, you're welcomed in the office. It is just a very unique situation.
We've always had a voice as physician leaders, and you don't find that frequently in a hospital-employed medical group.
To this day, I think Heritage Valley Healthcare System is one of the few healthcare systems in the region that has a nurse on their healthcare system board.
In the past, healthcare was really viewed as the two hospitals, and that only covered a slice of what people need in terms of healthcare. And our joint ventures have allowed us to extend healthcare across the continuum of life. So, for example, our Life Beaver County and Life Lawrence County allow us to deal with both the prevention and treatment of disease with our aging population.
One of the greatest pleasures I've had as a physician is taking care of people who I knew when I was growing up. I've taken care of teachers that used to be my teachers.
That's the benefit of working in the community you live in. So you have I believe, a more special bond with your patients because they're friends as well. And they're tied to you through your children, through your employment, through your activities in the community.
The physicians work and live here. The nurses are from the community. The employees are invested in the healthcare system and in the community, and all of that contributes to really being relevant to what the needs are. Both my husband and I have been patients here. My primary care provider is a Heritage Valley Healthcare System physician. He recently had an injury, and we came to the acute care setting on a Saturday morning. He had a ruptured Achilles tendon, and they provided him with the best care possible, addressing his pain and his concern. I'm a pretty critical consumer of healthcare, so whether I'm the patient or whether it's a member of my family, I'm watching every aspect of what's going on. And I have never been disappointed by a healthcare experience that I've had here.
People want care when they want it. It may be late at night, maybe Whenever your child is sick, that's when you need care. And so being able to have easy access to care at different times and close to your home is all, important to the community. Our family lives in Swickley, and we have 4 kids, and we were constantly visiting the hospital. And I learned from that experience what a gem it was to have a community-based hospital, and the difference it makes in people's lives.
This system has been a blessing to our family over the years. My mother was a volunteer here as a patient rep for many, many years. And, just what we've seen from all ends of the spectrum have been a real blessing to the family. In February of 2015, my mother passed away here at Heritage Valley Beaver. She's been a high utilizer of the system and has had a lot of health issues over the years. But that last week of her life was a real blessing for us. It was a difficult time, but we were supported by the system from the time we came in through the emergency department that cold February day to the time we met with the physicians in the chapel and decided it was time to terminate care and let her continue her journey. We were just surrounded with love and caring and compassion from start to finish.
20 years from now, I see a healthcare system that's very different from the healthcare system that we have today. And in many ways, much better than it is today. The shift in focus to helping people to be healthier and avoiding the kinds of situations and the kind of health behaviors that were not necessarily in their best interest, and focusing on providing individuals with resources to help keep them well and engaged in their own health care will result ultimately in better outcomes for everyone.
The hospitals themselves will be smaller. There'll be a lot fewer people spending the night in the hospital. Care will be delivered on outpatient basis largely in very convenient times, and technology will continue to improve care.
I think we're positioned appropriately and accordingly to move forward in the future. So I'm proud of that. I think our medical neighborhoods are a key to the future of medicine, that retail strategy. The way we can do those strategies is through the strength of our balance sheet, of which we're very proud.
Heritage Valley and being associated with it allows me to provide the best care for my patients. I'm able to do it in the way I've been trained to do it without being told how to practice medicine. The mission of Heritage Valley is to provide care to all in our community, and we're able to achieve that.
I don't think there's anybody in either organization that feels that what we did in consolidating was the wrong thing to do. I think they all believe that it worked. It's obvious it worked. We're here. And I think there is a sense of satisfaction on everybody's part.
There's no doubt in my mind that we made the right decision. We've had stability here, and we should take pride in that.
Our mission is to improve the health and well-being of all people in the communities we serve. And I believe that through the continuum of life, we really do that. As we say, we are uniquely connected for life.